Good morning students. Today we will discuss about the warning signs of cancer. The warning signs of cancer is coined by American Cancer Society. They coined the term caution us. So we will discuss about what is caution us. This is the 9 warning signs of cancer. Caution us, we can expand like this. C stands for change in bowel and bladder habits. A stands for a sore that does not heal. U for unusual bleeding or discharge. T for thickening or lump in the breast or elsewhere. And I for indigestion or difficulty in swallowing. O for obvious change in a wart or mole, and N for nagging cough or hoarseness of voice, and U stands for unexplained anemia, and S stands for sudden weight loss. So we will move on to each one in detail. Change in bowel or bladder habits. So when there is a sudden change in the bowel or bladder habits, like when it is not regular, like in case of if the person is having diarrhea or constipation, and or the person is experiencing a change in the stool caliber, or the patient is having some feeling of incomplete bowel emptying, these are symptoms may be an indication of colon cancer. Likewise, a change in the bladder function, frequency, dysuria, retention or hematuria may indicate prostate or bladder cancer. The next one is a sore that does not heal. Skin cancers, they look like a spot or sore that does not heal, that may be having some itching, or it may hurts the patient, or it will be looks like scabbed or crusty, or sometimes it may bleed, or we can see areas where the skin has broken, like in case of ulcers, and these particular ulcers or the sores, they will not heal for more than 4 weeks. Along with that, long lasting ulcers in the mouth, it could be an indication of oral cancer. So skin lesions are maybe an indication of any of the skin cancers. The next one is unusual bleeding or discharge. Any unusual bleeding or discharge can signify the malignancy, like in case of occult or bright red bleeding may be an indication of colorectal cancer. Abnormal vaginal bleeding, it may be an indication of endometrial cancer or cervical cancer. Then when there is a clear milky or bloody discharge from the nipple, may be an indication of breast cancer. Or likewise, we usually come across the terms like hemoptysis or hematuria. Hemoptysis may be seen in lung cancer, and hematuria may be an indication of bladder cancer, renal or prostate cancer. The next one is thickening or lump in breast or elsewhere. When there is a painless lump or mass, which is most commonly presenting sign for breast cancer, or maybe testis cancer, or it may be a soft tissue sarcoma. So these lumps, and also when there is a persistent enlarged lymph nodes, they also signify lymphoma or the metastatic nodal diseases. The next one is indigestion or difficulty in swallowing. When there is a sudden onset of indigestion which is painful, it may be an indication of CA stomach. Likewise, indigestion along with GERD, gastroesophageal reflux diseases, and when the person is experiencing a painful spasm after eating, or the person is having some difficulty in swallowing, can be symptoms of cancers of esophagus or cancers of larynx. The next one is obvious change in wart or mole. When there is a change in the mole's color, pigmentation pattern, when you are seeing irregularities in the mole's borders, or when you are seeing some differences in the surface topography, or the mole is increasing in size day by day, it may be an indication for skin cancer. And usually this type of changes in moles usually occurs in men in the upper back, and in females. And in females also the common changes will be occurring in the upper back, and in case of older adults we can see this type of changes in moles in the neck, scalp, face and ears. Then the next one is nagging cough. That is 7th warning sign, nagging cough or hoarseness of voice. So when there is persistent productive cough, which is most commonly reported in case of lung cancer. And if the person is having some hoarseness of voice, that may be an indication of lung cancer or CA larynx or maybe a thyroid cancer. And the next one is unexplained anemia. Most of the cancers can cause anemia. Like example, in this iron deficiency anemia is commonly seen along with the bowel cancers, but we cannot confirm the diagnosis only with the use of this iron deficiency anemia. We need to go for an endoscopy or X-ray studies of the upper and lower intestinal tracts to confirm the diagnosis. And the last one, the 9th warning sign, it is the sudden weight loss. So most of the people with the cancer, they will experience weight loss at some point of their cancer period. So what is unexplained weight loss? Unexplained weight loss means when there is no weight loss is occurring, but there is no reason to there is no justification for the person. Like we are not doing any, intentionally not doing any weight loss activities, like we are not going for any dieting or we are not doing any exercises to reduce our weight. Even during that time also, if the weight is reducing 5 kilogram or more, it may be a first sign of cancer. So usually this type of sudden weight loss is occurring in cancers like CA pancreas, CA stomach, CA esophagus and CA lungs. So today we discussed about the warning signs of cancer. Caution us, that is the 9 warning signs which is coined by American Cancer Society. So identifying these cancer signs, early identification is very important in the cancer treatment, because early identification increases the prognosis of the patient. Early identification and treatment increases the prognosis and we can fight against the cancer. Thank you one and all.